Okay, so you're ready to do the Keryflex?
Ready.
Ready? Okay, now of course, as you always know, I always want to do it natural. So you don't want to go too far, and you don't want to take the Keryflex too far from where you have actual nail to where there is no nail, because then it can lift. So that's why it's important. We'll just put the Keryflex up to this level and it will look natural, and that's the goal. Okay, I'm gonna lift the chair up. Are you comfortable?
Yeah.
Okay. All right, I'm gonna just first clean off the Keryflex, any debris on the nail with some alcohol pads. You always wanna make sure within a day, like 2 to 3 days before we do the Keryflex, that you never put oils on the nail, because the oil can lift the Keryflex and decrease the life of it. And Keryflex is expected to stay on anywhere from 4 to 8 weeks. Some of my patients get much longer out of it too. So another thing, after we clean off any debris, I'm gonna just file the nail. Okay, are you ready? Okay. This also helps take off any debris or oils, and it lifts the top layer of the nail so that the Keryflex can absorb much deeper in there. Are you in any pain, or you feel okay?
All looks good.
Great. Okay, let's clean that off. Any concerns or anything that you want to make sure we address in terms of the width or thickness of it?
How's the thickness? Should we file it? Maybe this one looks a bit, you can feel it. It's kind of like a...
Yeah, this right here is part of it is the skin. So right over here is the skin, and I don't want to go down too deep, because then you don't want to damage the nail bed. So the best thing is to put the Keryflex on, and then we could file accordingly, because that almost acts as a protective layer, so you're not damaging the nail bed. This is the bonding agent that I was talking about before. It's a very light layer. It's not sticky, it's not a heavy glue, as I mentioned before, where acrylic, when you get acrylic nails, they use a very strong glue that can rip off half of the nail bed. This is very, very light. Okay, now we're going to apply the resin, which is actually used in dentistry, and it's very light. In your particular case, what I suggest we do first is we start with the Keryflex at the tip of the nail, because that you don't have any nail there, and it's a different level than the base of your nail. So we want to build this up first and then bring it up to one level. That's key with having it look more natural and last longer. I'm just gonna
color.
And color. I use opaque. There's different colors in Keryflex. There's opaque, and then there's also translucent. With the translucent, you could see right through to the base, which I don't like. I like to have a little bit of an opaque color, so you're not seeing directly at the nail bed. Okay. And what we do is now I'm going to use the UV light to cure this. This UV light goes on for about 2 minutes. And you can see it's pretty much pain-free. And that's another nice thing too. Once we have the Keryflex on the nail, and then I file it down to make it thinner, it's not going to hurt you as much, because if I use just the Dremel directly on your nail bed, that would have hurt, because there's no protective layer on there. So the Keryflex acts as a protective layer, so I can go a little bit more, yeah. And now before I put the second layer on, I'm just going to take an alcohol pad just to wipe any residue or film that's left over from the first layer. And you can see it's already starting to shape a nail here. Now I'm going to put the second layer. I'm still going to work my way at the distal part of the nail, just because I want to build that up again before. A lot of times when people do Keryflex, they just try to do one big layer, and it doesn't flow nice because then it's too thick at the base.
So it's better to do it in kind of a dual stage.
A dual stage, especially too in your particular case where there's no nail and there's a drop, like a divot in. And then if you look from the side too, you can see we still have to build up, but we're also going to be filing that down too to help match that.
So it'll be kind of the same height.
Exactly, because you don't want it too thick. See, now we're getting this spot down more. And you're going to see some imperfections in the nail, which is fine because you're going to put nail polish over it, so you won't be able to see the imperfections when you put the polish on. But I could hide it, but I would have to make the Keryflex thicker, and I don't want to do that. I want to keep it at a nice even level. And you see how much more we're getting this down now that you already have the Keryflex layer, and then it's protecting that nail bed that was exposed, so we could take care of both things. Looks awesome. I'll end it here, so I'll try to go over that mark a little bit.
So that covers it.
Yeah.
A little bit, yeah. Makes it look a little bit more
A
natural.
little, yeah. Perfect, and then we're going to cure this.
Hard because you have to feel for it.
I know, and then you can't tell until you really put polish on.
Oh yeah, maybe that is just a
Little, yeah. See the
higher.
ridge here, that's where yeah, let me just get a light
A little bit.
in here. Sealant, that's the last layer that goes on. And what this does is it just helps block any moisture from getting into the Keryflex. Now it's so important with Keryflex to make sure that the Keryflex stays attached to the nail bed. What happens over time, like people will go several months with the Keryflex on, it will be loose at the end of the nail. And what could happen is water can get trapped in there. You can get something what we call Pseudomonas, which is a fungal infection. So Pseudomonas is a water-loving fungus that grows underneath the nail. And that could happen if the Keryflex gets lifted. You'll see like a green hue on the nail. So that's why it's so important to keep the Keryflex on for 4 to 8 weeks. If it's solid and attached to the nail, you can go another month, but if it's starting to lift, then you want to replace it. So now I'm just going to cure the sealant for a few minutes. We'll wipe that off and you're ready to go.